The common man's look at the myths supporting the federal takeover of healthcare. The impact of the federal government taking over healthcare will be significant. Whether you are for it or against it, you need to voice your opinion to your government representatives. Being silent harms them by their having to make important decisions blindly. They can only guess what you want, and guessing is no way to make major decisions that affect us all. First, disregard the fact that nothing in the U.S. Constitution authorizes the federal government to provide health care, and that the Constitution further clarifies this to prohibit the federal government doing anything that it is not specifically authorized to do. Even though that is not a minor fact to ignore, let us look at 11 myths related to the federal government further entering the provision of health care. Myth number 1. The government takeover of health care will reduce the overall cost. Changing who pays for a service does not reduce the cost of that service. In reality, the cost of health care will rise due to the normal inefficiency, the bureaucracy, and politicizing when government gets involved in anything. Private insurance has an incentive to minimize cost. The federal government does not. Cost will increase. The most common claim of the president is that electronic record keeping will reduce cost. How we keep records will not greatly change the cost of the service. Myth number 2. The Congress has a handle on cost. To be sure, we can afford it. One need look no further than Congress's own visitor center to know that Congress does not accurately estimate cost. Budget cost was $265 million. Actual cost, $621 million. This was simply the construction of a building, and it was 243% of Congress's estimate. When the government comes up with the goal of $1 trillion over 10 years, one surely can read that as $2 to $3 trillion. Their figure is either a wild guess, or worse, picked as a number the government believes the people would accept, and then repeated as actual calculated costs so often that it becomes thought of as true. Where else does one need to look for proof Congress underestimates cost? Pick nearly anything. It would be much harder to find areas where the actual cost was under budget. Please recall Vice President Biden's recent admission that they misread the economy. With the healthcare portion of the economy approaching 20%, a similar misread could be catastrophic to the American taxpayer. Myth number 3. There will be no rationing of healthcare. Rationing is inevitable. Socialized medicine in Canada, Britain, and elsewhere have proven this. In some cases, it is outright rationing, such as Britain not allowing macular degeneration medicines to be used to save sight in more than one eye. In other areas, healthcare is rationed by the insidious method of delay and wait. This has been well reported in both countries. If you can't get an appointment for a year, that is rationed healthcare. President Obama is already stating elderly should consider hospice rather than medical care to extend life. What if the Supreme Court were asked if the 14th Amendment granting equal protection applies to government-funded health care? It would have to say it does. As we could never afford all the services without question to all people, the government would need to restrict services equally to all. There goes individualized doctor care, and all care would need to be government instructed and certainly rationed. The only ones exempted under the current planning from this rationing would be Congress and labor unions. Myth number 4. Everybody's satisfaction with and access to healthcare will rise. This is just nonsense on the surface. Our latest personal example of government efficiency and provision of service was a couple months back at tax time, April 2009. We had a simple question and called the IRS tax advice number. Their recording advised wait times were long and we should hang up and call a certain 800 number to receive more prompt service. Only problem is the number they advised us to call was the exact number we had first called. How can one arrange their own or loved one's health services from a bureaucracy with the efficiency typical of the government and expect to be satisfied? The government says nearly 45 million people are not covered now. That's actually not true, but we'll pass on that for now. How will access to any service increase when demand is increased by 45 million more people? It cannot.